Today is most probably last class by me for endocrinology. Another class will be taken by Subhasis sir of that ACTH that was not taught. Okay, that anti-pituitary ACTH that was left. So that wasn't taught that day. So that part is left. That will be taught by Subhasis sir. But calcium homeostasis today I'll finish. Okay. पिछले दिन क्या हुआ था? ক্যালসিয়ামের ব্যাপারে আমরা ডিসকাস করেছিলাম এন্ড আরেকটা কি আমরা পড়েছিলাম ফসফেট। আমরা তার আগে কি পড়েছিলাম PTH। So these three things were done yesterday, मतलब last Saturday. Today we will study the other two parts. So one thing I have talked about, 3 organ, 3 hormones. So what are the 3 organs responsible? What are the 3 organs responsible? First is bone, GIT and kidney. Okay, and what are the 3 hormones? Phosphate, okay, calcitonin, and vitamin D. Okay, so yesterday this was completed. Today we will only be discussing these 2 things, calcitonin and vitamin D, and we will sum up the chapter with a summary or a table. Okay, so simple, very simple, only 2 things we will relate, just like we related phosphatase with all these 3 organs. We will also think about or learn about the synthesis, first synthesis, then actions of all 3 organs. So that's how our 3 organ and 3 hormone model will be completed. Vitamin D কোথায় থাকে? From where you can get vitamin D? সবাই জানে বলো? সানরেজ বাইরে এত গরম বলা উচিত এটা তোমাদের। ভিটামিন ডি সানরেজ থেকে পাওয়া যায় জানো তো? ওকে, সো বলছো না কেন? এনিওয়ে, so vitamin D is not directly present in our skin. Okay, a precursor is present. Whenever sunlight comes into our skin, it reacts with certain chemicals and then slowly it transforms into vitamin D. So this is the synthesis of vitamin D. So vitamin D synthesis. First lekho 7-dehydroxy cholesterol. 7-dehydroxy, not dihydroxy. That is the precursor. Okay, dehydroxy. Form of the thing. 7-dehydroxy cholesterol. Okay. Sunlight. Okay, so this will come into our skin. Not this will come into our skin. Actually, this is in our skin. Okay, the sunlight comes. So we know sunlight helps to regenerate or generate vitamin D. So what is the sunlight? Sunlight has a lot of rays, lot of wavelengths. Okay, so specifically UV rays present in the sunlight. What UV rays? UVB. Okay, so the wavelength is 280 to 320. 320? Yeah, 320 nanometer. So UVB rays, UVB rays with this wavelength, okay, 280 to 320 nanometer. Only this ray will be able to convert this 7-dehydroxy cholesterol into further things. Okay, so in our skin, this is present. UVB rays of 280 to 320 nanometer comes from sunlight in our skin. Then this thing will slowly transform into other things and ultimately it rise to vitamin D. First একটা লিখে দিচ্ছি 7-dehydroxy লেখার দরকার নেই আর। Second, 7-dehydroxy with UVB rays it transforms into vitamin D3. Okay. Or another name of vitamin D3 is cholecalciferol. Like cholecalciferol. Okay. So this is the second line, vitamin D or cholecalciferol, vitamin D. But this is not the form in which all the functions occur. All the functions of vitamin D occur in another form. What's that? So then comes 20 hydroxylase. Okay. So this 25 hydroxylase will change cholecalciferol into 25. এখানে নামেই আছে 25 hydroxy cholecalciferol. Okay, বোঝা গেল কেন এটা বলছি? 25 from there, hydroxy from there. This is 25 hydroxylase. Okay, cholecalciferol. So it transforms into 25 hydroxy cholecalciferol. So cholecalciferol, this is vitamin D3. Okay, cholecalciferol, 25 hydroxylase, 25 hydroxy cholecalciferol. Simple. The name 25 hydroxylase added with the cholecalciferol, it will come like this. Again, 1 alpha hydroxylase comes to work with this. Like 1 alpha hydroxylase. Just like 25 hydroxylase, there is 1 alpha hydroxylase. Important to remember is, in this case, this cholecalciferol, okay, or this 25 hydroxy cholecalciferol, this is exclusively, this function is happening, or this transformation is happening in where? Liver. Okay, so vitamin D3 assessment, we can assess the liver by investigation vitamin D3. Okay. So by assessing the cholecalciferol level, we can understand if this transformation is happening in the liver or not. Okay. If this amount is very high, amount of vitamin D3 in liver is very high, then most probably it is not converting into that. And if this is very high, it is very much convenient that this is getting converted into that. That's why it's in higher amount. So by assessing the vitamin D3 level in liver, we can assess if this transformation is happening readily or not. বোঝা গেল? কিছুই কঠিন না। 25 hydroxy cholecalciferol, 1 alpha hydroxylase. বলো নামটা কি হবে ভেবে বলো। 1 একটা এখান থেকে নেব, 25 ওখান থেকে নেব। কিভাবে? 1 25. Now this was hydroxy, but here is 2 hydroxy groups, one from this hydroxy group, another from this hydroxy group. So এটার নাম কি হবে? 125 dihydroxy, 125 dihydroxy কি নাম হবে? cholecalciferol. Okay, if you try to mark it up, you cannot remember. It's very easy if you understand. Once again I am repeating, cholecalciferol, 25 hydroxylase, 25 hydroxy cholecalciferol. Now 25 hydroxy cholecalciferol, 1 alpha hydroxylase. This happens in kidney, this happens in liver, and this transformation happens in kidney. So 2 different organs are coming into function. Okay. So now 20 হয় কি হবে? 125 dihydroxy, because there are 2 hydroxy groups form 2 hydroxylases. So 125 dihydroxy cholecalciferol. This is the active and functional form of vitamin D. So this is the functional. Whenever we say that vitamin D is working, you have to remember that this form is working. Okay, not all these forms, only this form works. Just like thyroid, the T3 were doing all the important, okay, physiological things, and T4 was used in synthesized drug product. Just like that, this 125 dihydroxy cholecalciferol is doing all the functional works in case of vitamin D. But if we want to, assess the level of vitamin D, we have to assess vitamin D3 or cholecalciferol. Okay, that comes under liver test. So vitamin D3 assessment is needed. That's cholecalciferol assessment. Okay, despite dihydroxy 125 dihydroxy cholecalciferol is being functional for all the physiological actions, we have to assess the cholecalciferol level to understand if vitamin D is all right or not. So this is the basic synthesis. Okay, nothing much. Now we should move on to action. So this is synthesis টা বোঝা গেল কিভাবে হয় সানলাইট থেকে একের পর এক, very easy. Now action of vitamin D3 in all the three organs. Okay, we should relate. So previous day when I was talking about phosphate, I have already talked a little bit about vitamin D. We'll continue from there. So first function of vitamin D3 or vitamin D. Okay, so vitamin D এর সবচেয়ে আগে ফাংশন কোথায় হবে? Bones. বলে কি করে ওটা? What does it do? It does is by or dual function. Okay. Despite popular belief, vitamin D is responsible for both bone destruction and bone repairing. Okay, so dual function. How? Whenever there is low calcium, okay, vitamin D helps in bone resorption. You mean bone destruction. B, whenever there is high calcium level, it will help in bone formation. Resorption mean মানে কি বলেছিলাম? Destruction. Okay, or breakdown. So action of vitamin D on bones is dependent upon calcium level. Whenever there is no calcium level, it will act as bone destructive factor, and whenever there is high calcium level, it will act as formative factor. So bone formation. So by this way, it, despite popular belief or contrary to popular belief, it has dual action on bones. It can both destroy the bones or it can both form the bones, okay, or increase the characteristic stability of the bones. So vitamin D and calcium is together very important. If a person has very good level of vitamin D but low calcium, his bone will not prosper, his bone will get destructed. Okay, only high calcium level is needed to form the bone, okay, in presence of vitamin D. Vitamin D alone cannot act on bone or cannot form bone growth, okay, cannot transpire bone growth. It needs calcium level also. So this is this action of bone, the action of vitamin D on bones. Second, bones হয়ে গেল. Then what is the other organs left? Bones ছাড়া kidney and GIT. Okay, so in case of GIT, vitamin D is the only factor which increases what? Calcium. So phosphate, if you remember, it was decreasing calcium absorption in GIT. Second is GIT. In GIT, vitamin D3 only substance, one and only substance which helps in calcium absorption. Okay. Phosphate decreases calcium absorption in GIT. पिछले दिन मैंने बोला था. So vitamin D, only vitamin D increases calcium absorption in GIT. This is the only action on GIT by three factors. What factors and in which place it helps this calcium absorption? In which place of the GIT? That is duodenum. देखो, in duodenum there are three factors. What? It increases three factors. What? Calbindin. বুঝে যাচ্ছে? Calbindin. Second is increase in calbindin. Second is increase in calcium ATPase. Okay, Ca2 plus ATPase. Calcium ATPase. and third is increase in alkaline phosphatase. Alkaline phosphatase. Okay. Okay. So increasing cal binding by increasing calcium ATPase and also increasing alkaline phosphatase. Vitamin D3 is the only factor which helps calcium absorption or increases calcium absorption. Okay, nothing much, very easy. Now, third is GIT হয়ে গেল, আমার bones হয়ে গেল. Only factor or only organ left in case of vitamin D is kidney. তাহলে এগুলো লিখেছো cal binding, calcium ATPase and alkaline phosphatase. Okay, by increasing these three factors it helps in calcium absorption. লিখে নিয়েছো, মুছে দিচ্ছি, জিজ্ঞেস করাটা বলে দেবো, মিস হয়ে গেল. থার্ড ইজ কি করে? So in case of kidney, calcium, if you remember, phosphate it was decreasing. Okay, sorry, it was increasing calcium reabsorption but decreasing, okay, decreasing phosphate. So phosphate that was decreasing in case of what? Reabsorption. Okay. So now what is this action? This action is performed by আগের দিনই বলেছি কি PTH. PTH, okay, PTH is showing this action, but if you remember, PTH vitamin D3, it will increase both. Okay, increases both calcium and only calcium reabsorb. So difference from PTH, okay, difference from PTH is what? PTH was responsible for increasing calcium and decreasing phosphate. So it was partial to calcium. Partiality দেখাচ্ছিল, সেই জন্য ফসফেটকে কমিয়ে দিয়েছিল, ক্যালসিয়ামকে বাড়িয়ে দিয়েছিল. But this is not partial. Vitamin D3 is very much fair. That's why it increases both calcium and phosphate in reabsorption in kidney. Okay, in distal tubules. Okay, this is the function of vitamin D in kidney. হয়ে গেল. Now vitamin D3 is done. It's very easy. It's short note can come. লিখতেই পারে কিভাবে, pathophysiology on three organs. This লিখে দেবে, ওই ছকটা লিখে দেবে, নাম্বার পেয়ে যাবে, কোনো ব্যাপার না. Now vitamin is done. Now we will move on to what? Calcitonin. Okay, calcitonin, if you remember, last day I have also talked about another form, another substance, that was phosphatonin. Tonin means it helps to decrease. So phosphatonin was decreasing phosphate. Calcitonin will decrease what? Calcium. To decrease calcium level. Okay, main function. Calcitonin is decreasing calcium level. Phosphatonin is decreasing phosphate level. So decreasing calcium levels. So main function you all know. Now we will all see how this calcitonin is synthesized and how does it decrease calcium levels in all those three organs, or how is it responsible for decreased calcium level in our body. Okay, so calcitonin. Synthesis of calcitonin is from, if you remember, the thyroid gland. Okay, I talked about there were two cells. One was follicular cells. One was follicular cells and another was parafollicular. এই বলো, আগের দিনই পড়েছিলাম, what are the follicular cells responsible for? Storage of what? T3 and T4 সব খাতায় লেখা আছে, দেখো চেক করো। Those follicular cells, those colloid type, এরকম colloid type cells, okay, those were responsible for not synthesis but storage of T3 and T4 সব আগের দিন বলেছি, আগের দিন না, এটা দুদিন আগে বলেছি যখন থাইরয়েড পড়ানো হয়েছিল। follicular cells are responsible for storage T4 এগুলো সব পরীক্ষায় সেমিস্টারে কোশ্চেন করছি কিন্তু স্যার, এইচওডি স্যার আমাকে ফোন করেছিল তোমার এগুলো পড়ানো হয়ে গেছে কিনা, তো আমি তো সবই পড়ে দিয়েছি, তোমরা পড়ে আসবে, নাহলে কিন্তু লিখতে পারবে না। স্যার জিজ্ঞেস করবে, সিলেবাসে দিয়ে দিয়েছে কিন্তু সেমিস্টারে, আমার সবাইকে জিজ্ঞেস করে সিলেবাস কোশ্চেন করছিল স্যার, আমাকে আগের দিনই ফোন করেছিলেন, পড়বে এগুলো, কিচ্ছু পড়নি, সব আমি বলে দিয়েছি 2 সপ্তাহ 3 সপ্তাহ আগে। এগুলো তো সব সুন্দর করে আমি একে একে বলেছিলাম, বাজে আঁকি তাও একে একে বললাম, একটু পড়ো। এনিওয়ে, parafollicular cells, parafollicular C cells. So those are responsible for T3, T4 storage. Parafollicular cells, C cells, these are responsible for formation of calcitonin. Okay. So parafollicular T cells is responsible for calcitonin. Okay. Follicular cells লিখবে না, follicular cells are responsible for thyroid hormone storage. Okay. So এগুলো মুছে দিই, এইটা থাক। parafollicular cells, calcitonin. Now these parafollicular cells, they actually can sometimes form bone tumor, okay, bone tumor or other kind of tumors. So these parafollicular are responsible for some markers, tumors, okay. You mean carcinogenic tumors responsible for carcinoma tumors. Okay, so what kind of tumor? This is medullary carcinoma of parafollicular C cells কোথায় থাকে? thyroid gland এ। So medullary carcinoma of thyroid. Medullary, what kind of carcinoma? Medullary carcinoma of parafollicular cells are in thyroid gland. So naturally, medullary carcinoma of thyroid. Okay. So this medullary carcinoma of thyroid is often, often the parafollicular C cells are responsible. And since calcitonin is formed or synthesized from these cells, calcitonin can act as a tumor marker. কিভাবে? Now, this parafollicular C cell, okay, cancer, that means overactivity, overactive parafollicular C cells. So if calcitonin level is deranged or increased very much, okay, you can understand that maybe there is a carcinogenic chance of medullary carcinoma of thyroid. Now this calcitonin this way can act as a tumor marker for medullary carcinoma of thyroid. So calcitonin can act as tumor marker. Primary function, physiological function, decreasing calcium, serum calcium, and secondary function, clinical function, helps as a tumor marker, often used as a tumor marker for of from which calcitonin is synthesized from are often present in thyroid gland. এগুলো thyroid gland এ থাকে, তাই very simple. Now this is the basic synthesis of calcitonin. Now action on all those three things we will again repeat. First action on bone. Now this calcitonin was decreasing calcium, okay, so decreasing calcium, it will help in calcitonin on first bone. বোনের ক্ষেত্রে কি করছে? Now if you remember the PTH receptor কোথায় ছিল? Osteoclast. So calcitonin receptor osteoblast. just like PTH. Okay, so it mimics PTH. Action on bones. The similar mechanism we have written in case of PTH is actually similar in calcitonin also. Calcitonin receptors, those are present in osteoblast, okay, which is a छवि एक हमें osteoblast अलग-अलग picture draw करके मैं समझाया था, okay, how those receptors, how the PTH receptors, okay, work, just like that. Osteoblast, they are in osteoblast. কি রিলিজ করে অস্টিওব্লাস্টে? র‍্যাঙ্ক লাইগ্যান্ড, আগের দিনে চিলে বললাম র‍্যাঙ্ক লাইগ্যান্ড. So this rank ligand is released by osteoblast, which is ultimately this rank ligand will go and differentiate but osteoclast. আগের দিনে সব পড়ানো হয়েছে, খাতায় দেখো, differentiate osteoclast. Okay, so calcitonin receptors, just like PTH, they are receptors also in osteoblast. This osteoblast releases rank ligand. This rank ligand will differentiate osteoclast. Osteoclast differentiation means osteoclast এর কাজ কি? Bone resorption. আগের দিনই বলেছি osteoblast bone formation, osteoclast bone resorption or bone breakdown. So since calcitonin is increasing osteoclast differentiation, it will help in bone resorption. Helps. So differentiation of osteoclast further helps bone resorption because the function of osteoclasts are bone resorption only. Resorption means breakdown. Okay, so helps bone resorption. Okay, now this osteoclasts help bone resorption. Now this calcitonin, what will it do? Calcitonin will prevent this thing ultimately. Okay, despite now this PTH receptor, those who are present in osteoblast, these were helping. This PTH was helping in osteoclast, but calcitonin is coming. Calcitonin receptor is also present, but this calcitonin is okay. In the final stage, it acts opposite. It actually prevents this differentiation and prevents bone resorption. Now, if bone resorption is prevented, calcium was not needed anymore. So, ultimately decreasing serum calcium. Okay. If bone resorption is very hard or very much, what will happen? Bone breakdown will happen. If bone breakdown will happen, calcium level need to increase. But since calcitonin prevents bone resorption, okay, it will ultimately lessen the need of calcium level in body, ultimately decrease in serum calcium. So this way calcitonin helps in serum calcium decrease. Okay, so bone e বোঝা গেল কি করে ওরা ডিক্রিজ করে. Okay, GIT তে একটাই কাজ, nothing much, you don't have to understand much. What is calcitonin function? Decrease serum calcium level. So decrease serum calcium level, GIT কি হয়? Calcium absorption. So it will decrease calcium absorption from GIT. লেখো বোনটা লিখে নিয়েছো, GIT লেখো. So final কি? Prevent resorption, minimizing the need of calcium level in body. So prevent bone resorption, resulting in decreased calcium level. Of course, serum calcium. এই সিরাম মানে কি বলো? এত যে সিরাম ক্যালসিয়াম আমরা বলি, হোয়াট ইজ সিরাম? কেউ বলতে পারবে? ব্লাড, ব্লাডের পার্ট হয় তো সিরাম, জানো না? ওকে, সো ইফ ইউ কিপ ব্লাড, হাসপাতালে দেখবে এই তো ম্যামি যখন তোমাদের ব্লাড গুলো দিত, তো উপরে একটা পার্ট, an opaque part was ultimately, one part was precipitated, another part was above. একটা opaque part উপরে থাকতো, দেখেছো যখন রক্ত অনেকক্ষণ ধরে রাখা হয়? So that upper part, that is your serum. Okay, components of blood এ তো পড়েছিলে, একটা হচ্ছে তোমার সাইটস, যেটা হচ্ছে লিম্ফোসাইট, নট লিম্ফোসাইট, হচ্ছে কি লিম্ফোসাইট, মনোসাইট ওইগুলো ডব্লিউবিসি, আরবিসি এন্ড প্লেটলেটস। ওকে, এন্ড অ্যানাদার ওয়াজ প্লাজমা, ওইটাকেই আমরা সিরাম বলছি। ওকে, সো ইউ হ্যাভ টু আন্ডারস্ট্যান্ড হোয়াট ইজ সিরাম, না হলে তুমি কি করে বুঝবে। সো ইন ল্যাব they let the blood precipitate, okay, and take the serum on the upper side. That little bit of serum, all the liver function tests and all the kidney function tests like sodium, potassium, any kind of serum examination is done by only that clear, okay, clear opaque fluid or serum, বুঝতে পারলে? And the lower part contains blood components. So we have to understand what serum is. এগুলো হট করে যদি কেউ জিজ্ঞেস করে বলতে পারবে না, পরীক্ষায় পড়ে যাবে। ওকে, এগুলো তো ব্লাডের পার্ট, তোমাদের হেমাটোলজিতে বলা হয়েছে, পড়োনি কেন? থিওরি ক্লাসে তো স্যার সব বললো। এনিওয়ে, prevent bone resorption, decreasing serum calcium level, that is on function of bone. Second, GIT, decrease calcium. GIT তে কি করবে? Decrease calcium absorption. So if it decreases calcium absorption, automatically it will decrease serum calcium level. Okay, so nothing much to understand. In case of GIT, calcitonin simply decreases calcium absorption, resulting in decreasing serum calcium level. Bone হয়ে গেল, GIT হয়ে গেল, what's left? Kidney. Now same kidney তে কি করবে? Now absorption that was happening in what? GIT. Kidney তে কি হয়? Reabsorption হয়। So to decrease the calcium level in body, it will have to decrease calcium reabsorption. Very easy, very easy. Its only function is to decrease calcium level in the body. Bone में उस प्रोसेस से करता है। GIT তে ক্যালসিয়াম লেভেল অ্যাবজর্পশন কমিয়ে দেবে, ডিক্রিজ ক্যালসিয়াম অ্যাবজর্পশন রিজাল্টিং ইন ডিক্রিজ সিরাম ক্যালসিয়াম। কিডনি में ডিক্রিজ রিঅ্যাবজর্পশন আলটিমেটলি রিজাল্টিং ইন দ্য সেম ডিক্রিজ সিরাম ক্যালসিয়াম। নাথিং মাচ টু আন্ডারস্ট্যান্ড ইন কেস অফ ক্যালসিটোনিন ফাংশন। ওকে, ভেরি ইজি, কিছু বোঝার নেই, মুছে দিচ্ছি। বাট অ্যানাদার ক্লিনিক্যাল থিং ইজ 4. These are the 3 organ, 3 hormone module complete. But you have to understand there are one or two extra functions of calcitonin that's in pregnant and lactating mothers. কি করে? In case of pregnant and lactating mothers, now in case of pregnant and lactating mothers, bone is very important. Okay, in case of pregnant women, there is a huge pressure on the skeleton. So there's huge pressure on the skeleton, the body could not withhold. Okay? The body cannot withhold. Okay, if there is not significant bone strength. Okay, so this bone strength is managed by serum calcium. So, but calcitonin, despite decreasing serum calcium, actually helps in this bone strength in pregnant and lactating mother. This is another extra function of calcitonin. You have to remember, you have to write in exam. Okay, so কি করে? Calcitonin, if you remember just now, in case of bone, I have told you calcitonin what does what? Prevents bone resorption. So bone resorption, if it prevents, it will prevent bone breakdown. So in case of pregnant women, this only comes at work. Bone breakdown is decreased, so the bone strength is increased. Very simple. That's how it helps in pregnant women to increase or maintain their bone strength to carry the baby. Okay, the baby weight is huge. Okay, so by preventing this bone resorption, that's why আমি এখন ওটা মুছিনি, by preventing bone resorption, they helps in maintaining the bone strength in pregnant women and also lactating women. ঠিক আছে? So calcitonin is ultimately not a friend of calcium, but ultimately it is bone friendly because in always it decreases bone resorption. Okay, by that mechanism. So calcitonin, MCQ may come. Okay, which is the bone friendly. তোমাকে ক্যালসিয়াম দিয়ে দিল, ক্যালসিটোনিন দিয়ে দিল, ফসফেট দিয়ে দিল, and vitamin D দিয়ে দিল, okay, it can happen, which is a bone friendly substance, phosphate, calcium, vitamin D and calcitonin. I bet not one person will think calcitonin as the first option. Everyone will think either vitamin D or calcium, but those are not bone friendly. Okay, those are bone friendly, but calcitonin is actively called as bone friendly substance because of they prevent bone resorption. Okay, so the answer will be absolutely calcitonin, which you know maybe miss. You may miss if you don't understand the mechanism. Okay, mathatei asbe na. 99% people will think it's either vitamin D or serum calcium. I myself did this wrong. That's why I remember it very well. Okay, I was stumped because I didn't understand the pathophysiology correctly. So I just thought, okay, either it will be calcium or vitamin D, and both are incorrect. Okay. In my case, the fourth option was both A and B. A te chilo tomar vitamin D, B te chilo calcium, 3 te chilo calcitonin, 4 e chilo both A and B. I marked both A and B and it was wrong. Okay, calcitonin will be the right answer. এরকম কোশ্চেন আসতে পারে, এক নম্বরে তোমাদের এমসিকিউ দেয় তো মাঝে মাঝে, সো ইট ক্যান অলসো কাম। ওকে, and also you can also explain why calcitonin helps in bone resorption. Explain nothing, you have to explain the pathophysiology. So explanation, calcium is okay, phosphate and calcium have opposite function in case of what, kidney or GIT. You can understand, you can write একটা reabsorption help করছে, একটা reabsorption আটকে দিচ্ছে, so the difference you can explain. So lot of explain why, lot of short questions can come in. There are a lot of scopes for these questions from this chapter, actually from endocrinology, the total endocrinology also. So you have to understand the pathophysiology so that you can answer this correctly. This is very much, you know, very much scoring, because if you just understand a little bit, you can write and it cannot be wrong actually, because the substance is itself very less. If you write it in 2 or 3 lines, it will definitely be correct. Okay, so this is very high scoring chapter actually. If you understand it properly, try to study properly. Whatever I have told you is not much, okay, but when I studied to prepare this thing to teach you, it was actually huge. Okay, so if you can, you know, accommodate it in your memory by understanding, okay, and make it compact, it's very easy, nothing much. Now there are 2 things you need to understand extra. What? First is hypercalcemia of malignancy. In some malignancy there can be hypercalcemia. Okay, how? So hypercalcemia in malignancy. Okay, like lung. In case of lung, lot of kind of tumors can be seen. 2 types of tumors: small cell carcinoma and squamous cell carcinoma. You have heard of this, right? Squamous cell carcinoma. So these 2 things, of course, in lung. Okay, so this is called paraneoplastic syndrome. Why paraneoplastic? Meaning new cell generation. Normally the lining epithelium of lung is different. Okay, so small cell and squamous cell carcinoma, these are the normal lining epithelium of lung. So there is new cell formation, new type of cell formation. So this new type of cells are small cell or squamous cell. That's why these things also called paraneoplastic. Lekho paraneoplastic, new cell generation. Now কি আসছে paraneoplastic syndrome. Okay, and carcinoma in lung. Okay, and it is dependent upon one peptide, that's PTHrP, RP in short. Why? PTH related peptide. This is a protein. So this PTH related peptide can act as a marker for this hypercalcemic situation in malignancy, and this PTH-related peptide will also increase calcium. Okay, nothing to understand, basic explain why likhe debe. Or a short note, paraneoplastic syndrome or any short note. Okay, hypercalcemia in malignancy, explain, you should explain. In case of lung carcinoma, paraneoplastic syndrome, like small cell carcinoma and squamous cell carcinoma, there is a specific protein or peptide named PTHrP, meaning PTHrP means related peptide, which can increase calcium level. And on examination of PTHrP, okay, you will see elevated level of PTHrP, and also the serum calcium will show high serum calcium. So that is hypercalcemia in malignancy. PTHrP or PTH related peptide. Peptide is responsible for this, and this is actually the marker of, this can be used as a marker in these cases. High amount of PTHrP can denote there is a chance of this paraneoplastic syndrome carcinomas in lung. Okay, so this is a very short note. And another is bone formation markers. Okay, so there are a few markers which can help in bone formation. There are a few markers which helps in bone breakdown. नामगुलो तुम्हारा जानते होगे, bone formation markers and bone resorption markers. দুটো খুব বানাও, bone formation markers. There are 3 bone formation markers. Nothing, you have to just mug it up. Okay, you don't have to understand anything. Lekho osteocalcin, remember, osteo means bone, calcin calcium, osteocalcin. First bone formation marker. Second bone formation marker is, I have already told you this, alkaline phosphatase. Lekho alkaline phosphatase. And third is propeptides of type 1 collagen. Lekho propeptides of type 1 collagen. So what are the 3 bone formation markers or bone formating markers? Osteocalcin, alkaline phosphatase, and propeptides of type 1 collagen. Nothing to understand, just write this down. If the question comes, you should answer. Okay, mark it up and go to exam. Second, bone formation markers ho gelo. So there should be bone destruction marker, or bone destruction or breakdown means resorption. So there is bone resorption markers also. So these names are very easy, but bone resorption marker names are very hard. Okay, just write down, follow me. So calcitonin, alkaline phosphatase, and propeptides of type 1 collagen. That was bone formation markers. Resorption markers are, lekho, there are in blood also. So these bone destruction or bone resorption markers are in blood and also in urine. Okay, so in blood there are 3 components. One is catepsin K. देखो catepsin K, MMP and TRAP. Full form আমি just এক্ষুনি বলে দিচ্ছি. TRAP. Okay, catepsin K full form नहीं, this is the name. MMP and TRAP. MMP is matrix metalloproteinase. देखो matrix metalloproteinase. Okay, and proteinase. Proteinase বানান জানো? তবু লেখো proteinase. Okay, very hard, নামটা মনে রাখা very hard. Try to mark it up. And third is TRAP. TRAP means tartrate resistant alkaline phosphatase. AP is for alkaline phosphatase only. Tartrate resistant. Tartrate, just like citrate, that is a substance is tartrate. Okay, tartrate resistant alkaline phosphatase. लिखो tartrate resistant resistant alkaline phosphatase. So full form of MMP is matrix metalloproteinase. TRAP এর full form হলো tartrate resistant alkaline phosphatase. These three are okay bone resorption markers found in blood. Found in urine there are two. One is NTX and CTX. Okay, full form is almost same. N is different, C is different. Okay, so T for telopeptides. Okay, telopeptides. So N or C is type. So either N type, মানে N telopeptides. S means of collagen crosslinks. So write down. NTX means N telopeptides of collagen crosslinks. X for crosslinks. Okay, crosslinks এর জন্য ওরা X এখানে নাম দিয়েছে. So N telopeptides of collagen crosslinks and C is same C telopeptides of collagen crosslinks. So these two are bone resorption markers found in urine. Okay, if a question comes we have to write all this down. Okay, preferably this is actually a little hard for your age and for your syllabus, but yeah, since it's in the book the question can come, you have to write. Okay, so আরেকবার রিপিট করো. বোন ফর্মেশন মার্কার কি ছিল? তিনটে. কি কি ছিল আমায় বলো, সিকি বলো। অস্টিওক্যালসিন, অ্যালকালাইন ফসফেটেজ, আরেকটা কি ছিল? প্রোপেপটাইডস অফ টাইপ 1 কোলাজেন, তাই তো? আর বোন রিসর্পশন মার্কারস ব্লাড আর ইউরিন। ব্লাডে কি ছিল? ক্যাটেক্সিন কে, এমএমপি এন্ড টিআরএপি। এমএমপি মানে ম্যাট্রিক্স মেটালোপ্রোটিনেজ, টিআরএপি মানে টার্ট্রেট রেজিস্ট্যান্স অ্যালকালাইন ফসফেটেজ, এন্ড in case of urine NTX and CTX. N telopeptides of collagen crosslinks, X for collagen crosslink, and C telopeptide of collagen crosslinks. Okay, these names are hard, I understand, just write down and mark it up before exam. এখন থেকে মুখস্থ করতে গেলে মনে থাকবে না, পরীক্ষার আগের দিন পড়ে আসবে, লিখে চলে যাবে কোশ্চেনে। ঠিক আছে, so this concludes your overall calcium homeostasis. Now we will do a summary. Okay, তোমাদের যেটা বুঝলাম তোমরা আগের দিন যেগুলো পড়াই কিছু গিয়ে পড়ো না, সো আ সামারি ইজ নিডেড। সামারি, ওকে, লেখো আমার সাথে, আমাকে বলবে এক এক করে, আমি এখানে ফর্ম ফিল আপ করব। সো দেয়ার নিডস টু বি আ স্টিমুলাস। Write these three organs one by one below. First is লেখো bone, GIT, আরেকটা কি ছিল? কিডনি, and finally you have to write end result. Okay, so there is stimulus, there is end result, and in between write down three organs, and you know you should also write three organs, like no, not the three organs, the three hormones we talked about, but PTH আর দুটো কি ছিল? ভিটামিন ডি, আরেকটা কি ছিল? ক্যালসিটোনিন। ঠিক আছে, ক্যালসিটোনিন। নাও স্টিমুলাস ফর পিটিএইচ কি ছিল? স্টিমুলাস ফর পিটিএইচ আগের দিনের খাতা খোলো, মেলাও, প্রত্যেকটা জিনিস মেলাও, নিজেদের খাতা খুলে মেলাও। So bone. Stimulus was কিছুই না, decrease in serum calcium. PTH synthesis or secretion stimulation is decrease in bone. PTH is doing what? কি করছিল PTH? Increased that mechanism by rank ligand. What was PTH doing? Differentiation of osteoclast, ultimately increase in bone resorption. Differentiation of osteoclast are responsible for bone resorption. So right down in bone, PTH does increase in bone resorption. In GIT, I have already told you. Okay, in GIT, what does it do? PTH increase in D. What? Absorption. ঠিক আছে, সব আগের দিনে খাতা লেখা আছে, এই ছকটা পরে ঘরে গিয়ে মেলাবে। কিডনিতে দুটো কাজ ছিল, পিটিএইচ এর দুটো কাজ কি ছিল? ইনক্রিজ ক্যালসিয়াম অ্যাবসর্পশন, একটু আগে বললাম, বাট ইট ওয়াজ ডিক্রিজ ইন ফসফেট। সো ডিক্রিজ ইন ফসফেট reabsorption, sorry, কিডনিতে অ্যাবসর্পশন হয় না, রিঅ্যাবসর্পশন হয়। ডিক্রিজ ইন ক্যালসিয়াম রিঅ্যাবসর্পশন, ইনক্রিজ ইন ক্যালসিয়াম রিঅ্যাবসর্পশন এন্ড ডিক্রিজ ইন ফসফেট রিঅ্যাবসর্পশন, মিনিং ডিক্রিজ ইন ফসফেট লেভেল। ওকে, ডিক্রিজ ইন ফসফেট লেভেল, এটা ডিক্রিজ ইন ক্যালসিয়াম লেভেল। বোঝা গেল কি কাজ? बोन में इंक्रीज बोन रिसोर्प्शन, जीआईटी তে इंक्रीज विटामिन डी एब्जॉर्प्शन, किडनी তে इंक्रीज कैल्शियम रीअब्जॉर्प्शन, मीन इंक्रीजिंग सीरम कैल्शियम, डिक्रीज इन phosphate reabsorption, decrease in phosphate reabsorption means decrease in phosphate, serum phosphate, বুঝতে পারলেন? so end result of PTH is all those results combining, ultimately the end result is these only: increasing serum calcium and decrease in serum phosphate. বুঝা গেল? যেটা এখানে লিখেছিলাম এটাই আমি মুছে দিই একবার নিচে। So these things ultimately will end result of PTH metabolism is, or not metabolism, PTH action is increase in serum calcium and decrease in serum phosphate. Okay, this is your PTH. Now change. In case of vitamin D, responsible for stimulating vitamin D, Sigir bolo, 3 factors. What are the 3 factors? Is decrease in serum calcium, আজকে ওখানে বললাম। Second, decrease in phosphate level, and third is increase in PTH. Okay, so 3 stimuluses for vitamin D: decrease in serum calcium, decrease in phosphate level, increasing in PTH. If any of these 3 things happen, vitamin D synthesis will increase. বুঝতে পারলে? So bone এ vitamin D এর কাজ কি ছিল? শিগগির বলো। ডুয়াল মেকানিজম, আজকেই বললাম। কি কি ডুয়াল মেকানিজম? বোন রিসর্পশনও করে। when it does bone resorption, when there is low calcium level, সেই যে ওখানে লিখেছিলাম, low calcium level bone resorption and high calcium level bone formation. Okay, so bone में यही काज करे। GIT increase vitamin D absorption in PTH. Now GIT তে একটু আগেই বললাম vitamin D কি করে? It increases both calcium and phosphate. বোঝা গেল? একটু আগেই বললাম PTH was selective, it was biased, okay, but vitamin D is not biased. It will increase both calcium and phosphate absorption, okay, both calcium and phosphate absorption in what? GIT. Now 3 kidney check to আমরা বললাম সেম কি করে increase absorption, so it will increase calcium and increase phosphate reabsorption, kidney te reabsorption, okay, reabsorption. So by increasing this calcium and phosphate both reabsorption in kidney, it increases, the end result is what is the end result? Both serum calcium and both serum phosphate is increased. বুঝতে পারছো কিভাবে reabsorption বাড়াচ্ছে কিডনিতে, absorption বাড়াচ্ছে GIT তে, okay, so all these things accumulatively, that's why the end result is increase in serum calcium and increase in serum phosphate. বোঝা গেল? Now one thing is left, calcitonin. So just answer this with your mind, not by books. If calcitonin is responsible for calcium destruction or decreasing the calcium level, which should be the stimulating factor of calcitonin? বলো, ভেবে বলো। If calcitonin is responsible for vitamin D destruction, not vitamin D, calcium destruction or lower calcium level, what is the stimuli should be for calcitonin secretion? Increased calcium level, है ना? Calcitonin এর কাজ হচ্ছে calcium level কে কমিয়ে দেওয়া. So whenever there will be increased calcium level, calcitonin will come. It will say ki okay, calcium level is increased, so I should go and decrease it. So the stimuli should be increase in calcium level, so that it can go and decrease the calcium. বুঝতে পারলে? So the only stimulus there is increase in serum calcium. So if there is increase in serum calcium, it will say okay, now it's increased, now I will secrete and I will go and decrease it. Okay, the sole function of calcitonin is decreasing calcium level. So the stimulus should be increase in serum calcium. এবার বলো বোনে কি করে? Calcitonin বোনে কি করছিল? Same mechanism as PTH, but the end opposite result. So PTH was increasing after rank ligand intervention. PTH was increasing bone resorption by differentiation of osteoclast, but calcitonin prevents the differentiation of osteoclast, ultimately preventing the bone resorption. আজকেই বললাম, so decrease bone resorption. এইটা আর এইটা আজকে বলেছি, এটা আগের দিন বলেছিলাম, ওকে। সো বোনে হয়ে গেল, এর একটা দাগ টানো। থার্ড ইজ ইন কেস অফ জিআইটি, একটু আগেই বললাম জিআইটি তে কি করে, is only sole job of calcitonin is decreasing calcium level. So in GIT it will decrease calcium absorption, nothing more. আজকেই বললাম, দেখো decrease calcium. If there is decreased calcium absorption, there must be lower serum calcium level. So this is about calcium absorption in GIT. Okay, action of calcitonin in GIT. Now final, kidney তে কি করে? Of course it will decrease calcium reabsorption, okay, by decreasing calcium reabsorption it will ultimately decrease serum calcium. So decrease calcium reabsorption. If calcium is reabsorbed less, what will happen? If calcium is not absorbed properly, it will ultimately decrease serum calcium level. So এখানে একটা দাগ টানি, okay. So So what is the end result? End result you all know, decrease in serum calcium, nothing more. So this is the summary of this chapter. Okay, চলো লেখো, লিখে এটা শেষ করো, কোনো কোশ্চেন থাকলে জিজ্ঞেস করো। ওকে।